Afternoon. It's Dr. Dawn, Chicago's own board certified OBGYN. My mission is to empower women and men of all ages with pertinent medical knowledge and proactive reproductive health that will optimize your physical and mental health. And just like everybody else and all of the newscasts and everything we're seeing, I thought I'd get on Facebook tonight and talk to you guys about how the coronavirus or COVID-19 will impact women that are pregnant. Before I start, though, I really have to impress upon us all to think about the last thing I talked about, which was your mental health. There's a lot of information out there. There are 24-hour newscasts. There are people that are getting on Facebook, Instagram, YouTube, and everybody's talking about this coronavirus. And it's very challenging to keep a level head in the midst of all of this that's going on. Not to mention, most of us, or a lot of us, are now starting to have friends and family that have been affected by this and affected adversely. Me, myself, I got some news yesterday about a good friend of mine who passed at a young age of 46 from the COVID virus. So it's really more important for me now to talk to people about it and try to give people just basic information, things you can think about, things to keep in mind, so that the information is out there. And I impress upon people to not think of this as an older person's disease or older person's problem. When it first came out, a lot of us were like, oh, it's 60 with diabetes and high problems and things like that. And initially, we thought that was really who would have adverse effects. But I can tell you, just from talking to friends and families and other physicians that are on the front lines, it's not just the older person's disease. All of us have to be careful. So those of us who are in our 30s or 40s or 50s, we still have to be careful and really be mindful of what is out there so that we can protect ourselves and protect our friends and family. So although this information is not necessarily only for pregnant ladies, I figured we'll kind of start at the beginning. Coronavirus is just a virus. It's a virus that's been out there. It typically causes just regular cold and flu symptoms. But this is a novel coronavirus, and meaning that this is the first time this particular virus has been out. And then from what we are seeing, what the reports are saying, what a lot of my friends that are intensivists that are talking to us or talking to me about it is that this one is just way more deadly. How so? It moves quicker in terms of when it moves from being mild to being severe cases. So you may have someone that picks this virus up and they may just have coughing and fever. Maybe they'll get muscle aches. I want to thank everybody that's joining in. My cousin Valencia, Scott, Robin, Dr. Donna, Dr. Watley, rather. And so this virus, people pick it up. They may have routine symptoms, and then it goes from 0 to 100. And these same people are now needing to go to an intensive care unit and need to use the ventilator and may have a poor outcome. And these are not just people who are 60 and above. So like my parents and grandparents and people who we have been shutting in the house for the last 4 weeks. These are people who are 30 to 50. They have good health. They jog down, well, not the lakefront anymore because I'm in Chicago and Mayor Lightfoot shut that down. But they're jogging in the streets now and they get their regular exercise, and they do this because they have, a very strong health ethic. They're trying to stay healthy. These people are coming down sick too. So I really want to warn people and keep it in your mind that everybody needs to be careful. Everybody needs to practice safe practices in terms of what's going on with this coronavirus pandemic. So it's basically coronavirus. COVID-19 is actually when you are symptomatic and you have the disease itself or infections going on. Some of the signs and symptoms that you want to be mindful of. And hey, Denise. Hey, Valerie. Thanks for joining. Fever, cough, a new cough. So this is not like a smoker's cough or a cough that you've had for off and on for 3 months. This is a new cough that's persistent. Fevers, cough, shortness of breath. Some of the things that I'm hearing about that, doctors and other people are talking about is loss of smell, loss of appetite, nausea. So those are some of the things that are symptomatics of symptoms that we need to pay attention to. The main thing is do not go directly into the ED. Call your doctor, and they will be able to kind of determine, because they know you, what these symptoms are, how severe they are. And a lot of us are just trying to get you directed towards testing versus going into the emergency room for mild symptoms. I know here in Illinois, the cases have neared 7,000. I think last check we had about 140 deaths. A couple of days ago, we had our first death of an infant. So it's getting pretty serious. Hey, Allison, thanks for joining. Hey, Denise, thanks for joining. It's getting pretty serious. So what are the things that you and I can do to help this not become as big of a problem? Anybody who's in healthcare, we all say the same thing. Stay home. If you do not need to be out in these streets, stay home. There's Instacart. There are a lot of the grocery stores have their own delivery services. So you don't necessarily have to be out getting to groceries unless you really, really, really have to get out there. But the best thing you could do for us that are on the front line, stay home. If you are out, practice the distancing. So we say 6 feet, but stay as far away as possible as you can. Again, I'm here in the city. They shut down the lakefront. I just drove to pick up a car because I have to go to work tomorrow, and people are at the park. So yeah, it's great to go and get your exercise on. Hey, Dion, thanks for joining us. Hey, Sean, thanks for joining. But still try to be mindful of staying away from folks. Practices that social distancing. If you are not wearing gloves, a lot of us are wearing gloves, but you don't wear gloves, just try not to touch your face with your hands. And the thought process is because the virus can be on your hands. So how is this virus spread? This virus is spread through droplets, which means that people cough or they sneeze. They may sneeze or cough on their hands, or they sneeze and cough out into the air. Those droplets are propelled and they land. They either land on a person or they land on a surface. If they land on a person and that person uses their hand that has just gotten this droplet on it, then, hey, Portia, thanks for joining. Portal, thanks for joining. If those droplets land on their hand, they touch their mouth, they touch their eyes, their nose, anything that is a way for that virus to enter into your body, that's how you get that infection and get the virus that becomes internal. The thought process also, it might be on a surface. Again, touch it. Hey, Daniel, thanks for joining. You touch it. Again, touching your face, touching your nose, touching your eyes. You're not really thinking about it. And then it has access to get inside and set up shop. So just be wary of that and be thoughtful. So if you have a cough, plus or minus whether you should be wearing a mask, I would lean on the side of being super cautious and just put on a regular surgical mask or cover your mouth. Make sure you have hand sanitizer. Use that. Make sure you're washing your hands. Use the wash-in for 20 seconds. Do all the basic things that they're telling us to do. You'd be surprised how far that will go in helping stop this spread. And for those of us who are in the front end of this, who have to take care of patients, who don't have a choice but to go to work, we are appreciative of that because we are seeing this day to day. I'm seeing people that are sick and getting worse. And so, of course, I got to go home to my family, to my husband, got kids, all of the people who are doing these jobs that make them come in contact with other people. They have friends and families that they're also concerned about. My cousin is a policeman, and he has set up shop in his basement because he doesn't want to interact with his family in fear of passing this virus on to them. He's not somebody that can not go to work. And most of us in this type of a career, we enjoy bringing helping people. So we want to work, but we don't want to work and be put at a disadvantage. Hey, Carl, thanks for joining. So the symptoms we discussed: fever, cough, shortness of breath, mild nausea. You might get loss of smell. As it gets worse, you can get chest pressure. Sometimes people will have a new confusion. This again is a progression of symptoms. So maybe you start with just a fever and cough, but then as you progress with these symptoms, you start, getting more of these symptoms. You're coughing all the time, and you get disoriented, or you have a sense of delirium, or the person around you gets a sense of delirium. If that happens, you need to call or go immediately to the emergency room to get further evaluation, because you might be someone that needs to be hospitalized. Because like I said earlier, this infection moves very quickly. So you go from really mild to extremely severe. And I know physicians that are guys that are super healthy, that this had them out for a loop. They were in the bed, they couldn't get up, their family was really hit, and it takes a while also to recover. So with the typical cold, you might have a day or two, you coughing and sneezing, and then you're over it. With this COVID-19, it's taken us a while to even recover from it. And so most people that are recovering from it are saying, man, this had me on my back for a while. Like, I had to really take it easy. So the best thing is not to pick it up. The best thing is not to put yourself out there where you are increasing your risk of picking up this virus in the first place. So we talked about how it spread. I'm looking at my cheat sheet because I want to make sure I tell you guys everything. So those are the basic things. So my topic specifically, I'm an obstetrician. Right now I work as a hospitalist. I work specifically with OB/ED. So I am the first person to see our pregnant ladies when they go in to triage, and they may come in for labor problems or pregnancy related, or they may come in for something else, and my job is to kind of assess that person and see what's going on. So how does this infection, or what is the process? Is it changed? Is it different with pregnant ladies? So the thought process is most ladies that are pregnant are a little bit immunosuppressed because of pregnancy. That's just in general. Does that put you at a higher risk? Slightly. Not something that I want my pregnant ladies to get really upset about, but do keep that in mind. What we do see with this infection, COVID-19, is the pregnant ladies that do come down with it and they become mild to severe, they have even worse outcomes, okay? So we see ladies that are pushed into preterm labor, that are, as a result of that, might have a C-section. And the main thing we see are women that have severe COVID infections have a higher chance of move quickly to pneumonia, and they move quickly to something which is respiratory failure, which means they're on a vent. And once we even without ladies having COVID-19, anybody with acute respiratory failure who's pregnant, that is a very untoward situation. That's one of the things I remember from residency with pyelonephritis. If these ladies move toward respiratory failure because of pyelonephritis, which is another infection, you can have a big problem. So we're seeing similar things with this COVID-19 viral infection, that are pregnant ladies that have severe infections, they move very quickly towards needing respiratory assistance. So what can you anticipate then? What's going to happen when you come in and you see me, and let's say you've been screened down in the ER, you told them you had a cough, plus or minus you had a fever, you come up to triage and we see you. If you have a cough and a fever, or just a persistent cough, or you just, are having symptoms that are in line with COVID-19 or coronavirus, we're going to put you on a mask, and then we're going to test you. And depending on where you are, and hey, Tracy, thanks for joining. Depending on what state you're in, I'm in the state of Illinois. It really depends on how quickly, that will kind of let us know how quickly you'll get the results back. Because, of course, the main thing is to know whether you're positive or negative. So if we have a person of interest, we call them a PUI, that comes in, they have the symptoms, we give them a mask, and you will notice the staff will wear a mask. If you saw my rant before, maybe earlier this week, you saw how challenging it had been in the beginning for physicians and nurses and people that are taking care of patients to get N95s. What are N95s and why are they important? N95s are able to filter out very, very small particles, smallest particles that are out there. And the idea, hey Nicole, hey Matthew, thanks for joining. Hey Don, thanks for joining. The idea is that with this virus, it's super small. So we need something that's going to filter out that virus. If it's in the air from somebody coughing, or maybe you've been coughing, you don't want to spread that to someone else. So we are really trying to use the N95s to protect people from the droplets that can be dispersed. Hey, Dr. West, thanks for joining. From the droplets that can be dispersed if a person is coughing, sneezing, or what have you. So if you come on labor delivery and you're a person under investigation, we're going to give you a mask. The question then also a lot of ladies are asking is, hey, what do we do with my, partner here? We're going to screen him as well, or her as well. We're going to screen that partner. We're going to see if they have symptoms that lean us towards thinking they're a COVID positive. And to be quite honest, if we think they're COVID positive, probably we're going to remove them from the room. Typical labor and deliveries will allow one person, and that is it. One person has to be the same person, can be with you through the labor and delivery process. If that person is at all symptomatic, usually they'll get kicked out. And that is just to protect everybody that's there, the mother, the infant, which we'll talk about later, and the rest of the staff that's there. If this your partner is there and they're not symptomatic, and be truthful, because we've had stories of people or of a father who did not tell the truth about his symptoms, and he was positive. And I don't know if the infant was positive too. I want to say that the infant was positive too, but at least the mother and the father were positive. So now there's a higher risk for that infant to be positive. So be truthful with us. When we're taking care of you, we're asking you these questions. Think long term. I know you want to be there for the delivery, but you need to be there for graduation from high school. And if you're putting somebody at risk with this infection, it can have long-term repercussions. Hey, Dimitri, thanks for joining. So we're going to test. The mom is going to be tested, and she's going to have precautions on. The partner is going to be allowed in if they are not symptomatic. They're going to have a gown and gloves and mask. During labor and delivery process, things are going to go about the same. You will notice your OB doctor or your midwife or your family physician, whomever is delivering you, they're going to have, hey, Casey, thanks for joining. Hey, Tracy, thanks for joining. They're going to have an N95 mask. They'll probably have another mask over that. They'll have protective gear on. Of course, we're going to have our gloves and gowns on, but that's what you can anticipate. And again, a lot of studies are showing that labor can be an aerosol procedure, meaning those droplets can be out, so we have to protect ourselves. So you can anticipate all of that. Same situation if you have a C-section. Now, most of us are used to having gowns and gloves in a C-section. The difference is they'll probably have an N95 under that mask. You won't notice it because you're going to be behind the bleed drape and probably asleep, hopefully. But we all notice it because we are fighting hard to make sure that we are protected the way we should. I'm not going to rant now. That was another rant. I'll do that another time. So we then... you have your baby vaginally, C-section. Depending on where you're at, it's going to take a while for these tests to come back. Again, state of Illinois, shout out to my cousin Cherie. She works for Abbott. Abbott just came out with this COVID-19 testing that does not take a day. I want to say it takes 15 minutes. Don't quote me, but I know it's a rapid return, which is great. So if you are COVID-19 positive as a mother, if we find out during the labor and delivery process, or we find out after you deliver, I hate to be a bearer of bad news, but you will be separated from your infant, and that infant will then be tested. The idea is that if the partner that is with you is not symptomatic, the infant will stay with that partner, but you will be separated from that infant, so we know whether that infant is positive or not. Illinois, and there's a new state today that had the first infant death. So we had an infant death maybe 2-3 days ago. There was another infant death today. So, okay, Valerie, thanks. Valerie just said it probably takes about 5 minutes. And I know 5 was in my head. I didn't know if it was 5 or 15. But we have infants that have died from this. Apparently, the baby from today was about 6 weeks. So probably sent home. Maybe it was positive, during that time period. Somebody in the house was positive. The baby came back and didn't survive. So this is serious, guys. We need to take it seriously. Serious matter, and we need to act as such. So you will be separated. If you want to breastfeed, and we still are Connecticut. Thank you, Dr. Tracy. It was in Connecticut. If you do want to breastfeed, and we still, there's no contraindication to breastfeeding if you're coronavirus positive. We ask that you are, again, masking up, using good hand hygiene, and just pump. So you can pump the breast milk, and that breast milk will be put in a bottle, and somebody else will feed the infant your breast milk. So that's kind of it. Most of us now are really trying to get a 24, 48-hour discharge, especially for our vaginal deliveries. 2 to 3 days for our C-sections. As long as your symptoms are mild, you'll go home, you'll self-quarantine, and quarantine is about 14 days that you'll be from time of exposure. So that's kind of the gist of it. I don't see any questions. If anybody has questions, why don't you start putting them in? But that's kind of what you can anticipate if you're positive. And again, I want people to really think about the fact that if you're a pregnant woman and you become positive, you want to really stay on top of your symptoms, because it can move from mild to severe very quickly. Slightly higher chance for preterm labor, C-sections, things of that nature. So that is it. I don't really see any questions. Hey, Latanya, thanks for joining. Hey, Sean, thanks for joining. That's the gist of it. So thank you for joining me. I do these Facebook Lives on different topics throughout the week. Dr. Dawn, OBGYN. I am on Facebook. I'm on Instagram. I'm on YouTube. Usually I will post my videos from Facebook onto YouTube, so you can catch me there. But just spread this video if you know people that are pregnant or thinking about getting pregnant, or are close to delivery. I think this will be some good information for them to know, so that they can be less anxious during that process. And person with diabetes. So I got a question about how does COVID infection affect somebody with diabetes. Just off the cuff, I would say people with diabetes have a higher risk of infections anyway. Thanks, Tyrone. So I think that with diabetes, you just have to really be careful that you're staying on top of your blood sugars. With the other thing that I do with my job is I work with the high-risk patients. So we see a lot of pregnant ladies that have diabetes that are uncontrolled. Some ladies will develop diabetes during pregnancy, but some people have diabetes prior to pregnancy. Either case is very important to make sure your blood sugars are under control, and to really be on top of checking your blood sugar, letting your physician or your nurse practitioner who you're checking into, letting them know what your blood sugars are, because when those blood sugars are getting under control, higher risk of preterm labor, stillbirth, preterm delivery, and if you do have an infection, it's harder for us to treat that infection because you have that infection going. So I am not an MFM doc, but I would think that the infection with uncontrolled diabetes would make both processes a lot worse. Also, I got a question from Dr. Tracy. Do I think it's being passed at delivery or when they feed from respiratory secretions? That's a good question. And a lot of us have been concerned as to whether the infection can be passed in utero. And right now, we don't have any studies that have shown that it's passed in utero. So the thought process is that at some point, this infant picked it up either at delivery or in that process afterwards. So let's say the mother was a person of interest and she was interacting with the fetus, sorry, with the baby, and maybe slipped up and didn't use proper precautions for whatever reasons and passed it at that point. So that's kind of what we're leaning on with this baby from today. That baby had already been discharged, so that baby was brought back in. So I'm sure the thought process at that point was that at some point in the environment, that baby picked up that virus, and then because their immune system is not as hardy as ours, they got super sick. Hey, Dr. Shep, thanks for joining. So again, we don't have many studies or any studies as far as I know that are showing in utero passing it through. But we still have to be super careful, especially with breastfeeding, because not necessarily through the breast milk. We don't have any studies that showing that it's passed through the breast milk. But, this virus, you're using your hands. The thought process is probably maybe with your hands, you're touching the baby, the mouth, it gets into the, touching the baby's face at some point, and we're passing it along. That's kind of my understanding at this point. So do we have any other questions? Hopefully I kind of asked. Hey, Darius D, thanks for joining. Hopefully I asked your questions. So takeaways from this. Basically, for everybody, practice social distancing. Don't make this a joke. This is very serious. Stay at home when you can. Instacart is your friend. And if you are going in the environment, gloves, plus or minus a mask, wash your hands when you come back into the house. And with shopping, wash all your products that you have that you're bringing into the house. Wash your areas that you're around mostly. Get you a wipe, or you can get some bleach and some water, old school, spray it down, wipe down these knobs, wipe down these light fixtures, tables, countertops, anything that you are congregating and you're kind of leaning and touching and doing things with, wipe that down and do that on a regular basis, because that's really going to help you not to spread it even in the house. I know, D. I saw that information. And again, we have a lot of people that are my age, 30, 40, 50, that are coming and not surviving this infection. They're getting this infection and they are dying. So do not believe when the media at large is telling us it's 60 and above. If you're 60 and above patients or anything like my parents, they haven't been outside since February. They're listening to the advice. They're not going outside. Instacart person came, dropped the food off. My dad waved him away and made sure he drove off before he even opened the door to get his groceries. So the older folks, they're paying attention. They're not messing around. It's us going out and kikiing in front of, in each other's faces and doing like we normally do, as opposed to staying in house. We are getting a lot of people that are helping us, again, from Chicago. So DJ Vince Adam, he held it down this weekend, and that's 3 hours that we can stay in the house and at least listen to good music. Read a book, look at TV, do what you got to do, stay home. Thank you. So I'm going to call it a night. I got to go into work, so I got to get some rest. But look for more videos to start coming through on the Dr. Dawn Facebook, or even Dawn Dupart Facebook. And then I'm also going to start doing some from Instagram. So just follow me on those social media, and we'll be in contact, and stay safe. Remember, we are all into this together. All right, guys. Bye.